Hi, and welcome back to LifeWorks PRMC. I'm Roger Fallabout, the Director of Community Relations at Peninsula Regional Medical Center. And today we're going to talk about health literacy. What does it mean? Why is it important to all of us here on the Delmarva Peninsula? And joining us to talk about health literacy is Dr. Mark Edney, a urologist here in town. Dr. Edney, welcome.
Thanks for having me.
Great to have you back on the show, too. I know as a practicing urologist, as a frequent guest on programs here on PAC 14, officer of the medical staff at PRMC, there can't be anybody who doesn't know you already. But in the event that they don't know you, tell us a little bit about Mark Edney.
So I grew up in New Hampshire, in Concord, New Hampshire, which is a suburb of the capital, and very much a rural community, very much sort of like the Eastern Shore. A lot of dairy farms, a lot of rural hunting community, working class community, and went to high school there, public high school, and finished up, started to like science, and decided that I was going to go off to college and major in science. So I majored in biochemistry at St. Anselm College in Manchester, New Hampshire. And through my 4 years there, as I got more and more interested in science and started to look around at the different careers you can choose from science, including teaching and research and medicine, did some volunteering in an emergency room, and I was sold. I said, you know, I love that environment. I love what physicians are able to do in terms of creating connections with patients and helping solve problems on a very deep level. And so medicine became my choice, and got into medical school, did my training up at Dartmouth, which is also in New Hampshire, did medical school and urology residency there. And as soon as I finished residency in 2004, came here to the Eastern Shore, and we've been here ever since, and we love it here.
So how does a guy who enjoyed working in the emergency department get into a field like urology, which is so specialized?
Sure. So from that acute care environment, once you get into medical school, one of the first decisions you make is, do I want a internal medicine oriented sort of specialty where you see patients and you think about problems and you treat problems with medicines? Or do I want a more procedure-oriented operating type of experience? And I decided very early that I wanted to work in the operating room. I did some research with cardiothoracic surgeons, and the first operation that I was invited into as a student was a heart bypass operation. And I was just blown away with their capabilities in the operating room and the ability to sort of open someone's body, and blown away not only by the technology and the skill that was brought to bear, but the amazing amount of trust that particularly surgical patients place in their surgeons. I mean, to be able to say, I'm going to let you put me to sleep, open my body, change something, and close me up again, is a tremendous amount of trust. And I thought, boy, what a powerful way to spend a career if to be able to be entrusted with that level of trust and faith by patients, and to be able to do right by that trust is an incredibly rewarding career. So that's ultimately how I decided on surgery. And within surgery, you've got lots of choices to make. There's orthopedics and heart surgery and lots of different kinds. I did a rotation with urologists at Dartmouth, and I just love the variety of procedures that they did. Some specialties are fairly narrow. They do 3 or 4 different types of procedures. Urology is a much wider variety.
Yeah, pretty broad.
Can get into laparoscopic surgery and the robotics, which I like to do, and also some sort of more minor procedures, quick procedures, stone procedures, those sorts of things. So I like the variety of surgical procedures in urology. And there's also a very vibrant office practice. And so there's a lot of problems in urology that we can treat with medicines in the office before going to surgery, and some of our patients never need surgery. So it's also nice to have that part of the clinical practice where we can treat patients without necessarily having to do a procedure. So the bottom line is it's great surgery, and it's a great variety. So that's why I chose it.
Yeah, and I promise we'll get to health literacy here in a moment. But I also want to talk about this 100 Docs program that you launched recently with the United Way. Spectacular program. Tell us a little bit about that, if you would.
Sure. So there are a lot of physicians in our community who, through the years, have donated periodically to the United Way. Some donate every year, and others from time to time. And as I became involved with the United Way, one of the things that the board of the United Way approached me about was, hey, is there a way that we can kind of engage physicians in a more consistent way? So I started thinking about it, and I came up with the idea of a formal program through which the medical community on the Lower Shore could contribute to the United Way. And I thought, let's call it 100 Docs. My original goal was, if I could get 100 doctors to donate $1,000, it's $100,000 a year, and that would be a huge contribution.
Yeah, great contribution.
We're still trying to get to $100,000 a year, but I tell you what, it's been phenomenally successful. We are about to start our 4th cycle, And the group of dedicated physicians and medical personnel on the lower shore annually now are contributing between $50,000 and $60,000 as a group as part of this 100 Docs campaign. And so we've got lots of docs who are very reliable every year. They're sending in their contribution. We have some that'll do it one year and maybe miss a year and come back again. We're appreciative of all the contributions that they're able to come in with. But I think creating a program and having a sense that you're part of a program entices more people to join. And I think once they join, entices them to stay, because you feel like you're part of something bigger. It feels good to give $500 or $1,000 to United Way. And a lot of us sort of did that from time to time. But when you're part of a group that's generating $50,000 or $60,000 a year, that feels great.
Yeah.
And it really starts to feel like, as a group, you're having a tremendous impact for our neighbors who need it. And I tell you what, as far as nonprofit organizations who deliver the help needed to our neighbors who are suffering from a variety of different issues, whether it's healthcare or financial or educational issues, whatever it is, United Way is number one. And
Yeah.
it's a fabulous organization, and we're very proud to support it.
Great program, great way to give back, and thanks so much for spearheading that.
Sure.
You're also spearheading with Memo Duriker from Salisbury University and Pam Gregory from the United Way, this thing called health literacy. So I'll give you this big softball question to start this off. What is health literacy? What does it all mean?
Sure, it's a great question. So when we talk about literacy with respect to health, it's like literacy when we talk about anything else. Being literate is being functional in the communication of anything. So we talk about English language literacy or literacy in a foreign language like French or Spanish. It's basically having an ease of communication and understanding within that language. And so it's understanding, being able to read and understand what you're reading, or watching video and understanding what's being communicated, but it's also verbal communication and being able to both understand what's being told, but also to express yourself about what's bothering you or the things that you need. So all of those things are sort of captured in health literacy. And so health literacy is about, it starts with vocabulary. Like any new area that you're going to try to learn or become proficient in, you've got to learn the vocabulary. So health literacy often starts with the base of vocabulary. In the United States, we have the best, most technologically advanced healthcare in the world. Unfortunately, the system in which we deliver that care is a mess. It's way too expensive. The insurance, the patchwork insurance program that has sprouted up since after World War II, and this notion of employers providing private insurance, has really created an enormous and confusing patchwork of how healthcare is paid for. So you've got federal programs for seniors over 65. There's Medicare for the poor. There's Medicaid, and for the disabled, there's Medicaid. And then you have this whole private insurance area for folks who are employed. And it creates an enormous confusion. And so there's all these insurance terms to learn. In addition to learning the terms that go with your healthcare conditions, you got to learn about co-insurance and co-pays and deductibles and premiums. And what does all that mean? I mean, people will experience now almost across the board rising premiums and co-pays for the healthcare that they pay for. And so, why is that going on? So learning the vocabulary helps you then be conversant and start to be able to express yourself about your frustrations with the system, but also talk about what you need. So there are structural issues about talking about the healthcare structure, but then when you get down to what's bothering me and being able to understand how to access the healthcare system, there's a lot of vocabulary there. And those are the sorts of things that we're going to try to roll out in an educational platform, particularly to the most vulnerable in our population, folks who are poor, who may live in places that aren't healthy structurally, that don't have access to good food every day, that have problems making it to appointments and to visits, don't understand what it means to sort of establish with a primary care doctor, and so wait and put off healthcare issues until they become emergent. And then they wind up in the emergency room. So there's lots of issues there to be overcome, but it starts with learning a vocabulary and learning how to be conversant in not only in the disease process itself that you might be experiencing, but conversant in the system. What is urgent care? What's appropriate to take to urgent care? What sorts of things need to go to the emergency room? How do I identify a primary care, and when do I use them? All of that basic stuff is all encompassed in health literacy, and so there's a huge need out there for that level of education, and that's what the program is aiming to do.
I know as a patient of yours that you make it, or you attempt to make it very easy for me to understand what's going on with my health care, and you do a good good job of that. But this is an extremely complex issue to grasp. So how in the world, and you mentioned in particular to some of the most vulnerable of the population out there, how do you do this? How do you help them understand, and equally important, communicate back to you what's going on?
Sure. So you start at the beginning. And the first thing you do is, we'll talk about this train the trainer model that we have, but we're going to train people to then go out into these organizations and train the folks that we want to be the recipients of our training. But you start at the beginning, and you start with vocabulary, and you start with basic vocabulary. Things like insurance. What is insurance? How do I get insurance? What is Medicaid? What are deductibles and copays, and what is financial responsibility, and what are the different resources that are available? So you start basic with the system, and you start basic with what's a fever? How do you describe abdominal pain? What are the different ways that we can describe that? Not all abdominal pain's the same, okay? Difficulty with urination or bowels, or all sorts of things that can go on. A fever, how high is a fever? What's a significant fever? Do you have a thermometer at home? What is a thermometer? How do you use it? I mean, basic stuff, basic stuff. So that you can start to identify when things might be going wrong with you or a loved one or your child, and start to have a sense of what are these tools used for? How do we use a thermometer? When is a temperature important? When should I call someone? So learning all of these basic steps, then once you master the basics, then you'll start asking questions about the more advanced stuff. And so like any complicated subject, you start with the basics and you start with the basic vocabulary. Once you get a facility with that, then you go to the next level and you start talking about different degrees of complexity. So you start at the beginning, you take one step at a time.
You talked about this train the trainer concept. How important is that, and how does that work?
It's critical because, so you mentioned Dr. Dierker and myself are the kind of the leads at the United Way, and this is really a partnership, this effort between the hospital and Salisbury University and the United Way. But from the United Way perspective, we're the leads on this, and so there are actually some MBA grad students of his who are also helping develop this project. And together, we're going to train folks from United Way partner organizations in terms of the pilot and rolling this out. And then, so we're going to have those folks come. We're going to train them in the curriculum that we want communicated and make them the teachers. And the strength of doing that is you're really scaling a level of expertise that's housed currently with a few people. We're spreading that out.
Sure.
And so the more people you can train who can then train other people, it's exponential. And so you can get the word out to far more people if you can train others the basic things that you want communicated. So that's the process is we, between Dr. Dierker and myself and the interns, we're going to teach 3 or 4 agency folks who are interested in being teachers, teach them what needs to be taught, and then they're going to go out and teach a bunch of others. And in the process, they may teach others who can then teach others. And once you sort of head out from, fan out from the central core,
Sure.
all of a sudden you're touching hundreds and hopefully eventually thousands of lives.
Yeah, maybe thousands of people too.
Thousands of lives.
Yeah. A couple of minutes left in the show.
Sure.
What would you like all of us to do to become more health literate? What should we be concentrating on?
Number one is ask questions. And there are a lot of ways to ask questions. Certainly when you're with your healthcare provider, don't ever leave that interaction with questions in your mind. And no question, there are no bad questions. And I've often experienced this when I'm taking care of folks. People will say, will feel a little bit embarrassed asking questions that they think maybe are too obvious or that they should know. Never feel embarrassed or that you don't know something, because healthcare is extremely complicated, and a lot of the disease processes that we deal with are very complicated and they're hard. Your doctor's an expert, but you're paying them for their expertise, and so you should really approach that as I'm paying you for all of the knowledge you have about what's going on with me, and I want to sort of take all of that knowledge, everything that you have, I want. And so if you need to be aggressive about extracting information, if there's any question you have, ask it. And if you don't understand the way it was presented to you, and that's possible, you may ask, and they may tell you something, you say, I have no idea what that person just said.
Sure.
Say, can you please say that again? I didn't really understand what you said. Can you say it in a different way? So really take the time to do that. And that's the number one thing, ask questions. Be careful about accessing information online. The bottom line is you need to educate yourself, and there's lots of different ways to do that. The best source is your, the one-on-one with your healthcare provider. There's a lot of stuff online, but be careful. There's good stuff and bad stuff. Stick to reputable websites. Most of the national organizations in urology, the American Urologic Association has a website. There's the American College of Surgeons and Surgery. There's American Cancer Society for cancer questions. Stick to big, reputable websites. Once you get off the mainstream websites, you will read everything under the sun about your condition. You'll scare yourself, quite honestly. I have people that come in who have done their own research about whatever we're about to talk about, and they are scared to death because they've seen a lot of horror stories that actually end up being inaccurate.
Yeah.
Because there's not a lot of guidance. The internet is still kind of the Wild West.
Yeah, it is the Wild West.
And you can get out there and you can find anything. So don't scare yourself. Stick to reputable websites. Don't get onto blogs that are talking about sort of odd angles, because they're often filled with just misinformation. Sometimes well-meaning people that just don't know what they're talking about, and other times people, unfortunately, actively trying to confuse others.
Yeah.
And so there's a lot of that out there. So be careful. There's a lot of good stuff on the internet. Stick to reputable websites.
Good advice. And Dr. Edney, thanks so much for being here on the program.
Sure.
Best of luck with this health literacy program. Hope things go great for you.
Thanks, Roger.
All right. And that'll do it for this edition of LifeWorks PRMC. For Dr. Mark Edney and all of us here at PAC 14. I want to thank you for being a part of the show tonight. If you have some ideas about programs that you'd like to see, I would love to hear from you. And the best way to do that is to email me at roger.fallabout@peninsula.org or call me at the hospital the old-fashioned way via the phone at 410-543-7142. Again, my thanks to Dr. Mark Edney. My thanks to everyone here at PAC 14. Take care of yourselves, and we'll see you again soon.